for the press. Press feed, I see a thumbs up. KBC. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Two.
Test, test, 1, 2, 3, testing, 1, 2, 3, testing, testing.
Two, 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 1, 2. 3, 4, 5, 6, 7, 8.
What? probably need to pull it over on the other side. Just like here, if I hold the pole, could you, if I hold this, can you just pull it over? It's just hard, it's just like, yeah. Okay, perfect. I can, well,
It always goes back and forth.
it is what it is.
Count on me and my foundation in any way, shape, or form. I'm serious about it. And I know that you can't. I mean, San Bernardino can do something.
I think that's good.
Yeah, perfect.
Yeah, I think that's good.
Thank you.
Check for the press. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3. Good morning and welcome. 1, 2, 3.
She helps us with yeah.
Greetings and welcome to the Martin Luther King Jr. Behavioral Health Center, or what we call the BHC. My name is Anton Moore, and among other things, I am the Department of Public Health's Administrative Lead for Substance Use Services here at the BHC. We selected this location because it is a demonstration of what effective collaborations can do to support people with substance use disorder and mental health conditions. A similar collaboration is represented here. on National Opioid Awareness Day to take action around the increases in fentanyl and fentanyl-related overdoses in our communities. This sixth-floor, state-of-the-art facility is the vision of the 2nd Supervisorial District to create an innovative hub for the people of Willowbrook and surrounding neighborhoods and ensure quality behavioral health, treatment, and recovery support in a coordinated manner. 5 different county departments and several community-based organizations, some of whom are represented here today, have worked together to achieve this vision, providing mental health, substance use disorder treatment, probation services, primary and urgent care, mental health urgent care, and sobering center services. This includes our social enterprise organization, Homeboys Industries, who prepares healthy meals for those receiving substance use and mental health residential treatment services. This co-location not only makes it easier for local residents and others to access a diverse array of services necessary for holistic health, but also facilitates a continuum of care that promotes physical, mental, and emotional well-being, as well as transformative and healing future. We have a lot to share with you today, so without further ado, I would like to introduce Dr. Barbara Ferrer, Director of Department of Public Health, to provide introductory remarks. Thank you.
Good morning, and thank you so much, Anton, for welcoming us to this beautiful, beautiful center that really offers hope for so many in our communities by offering sort of a really full continuum of service and support. And I also want to thank all of the providers that are here and the staff that work at the center for your work, life-saving work, deeply, deeply appreciated. The unwavering commitment and contributions that you see presented here today have strengthened our collective efforts to combat the overdose crisis throughout LA County, with a focus on reducing demand and supply through prevention and engagement activities. I do want to acknowledge and thank the Board of Supervisors who have really lent their full support to creating spaces like this and expanding our reach throughout the entire county. And I also want to acknowledge and thank organizations that serve the community in a different capacity on this campus, including the hospital next door and the Charles Drew Magnet School that's right around the corner, as well as our Tarzana treatment centers, other SUD providers that may have joined us this morning. I'm really pleased today to have the following speakers with us, and I want to acknowledge and thank them personally for joining us. Yolanda Vera is here. She is the Chief Health Deputy, Senior Health Deputy for Supervisor Holly Mitchell's office, and she'll talk about the importance of primary prevention. We have Dr. Deborah Eduardo from the LA County Office of Education, our brilliant partner on so many issues, who's joined us, who'll talk about how schools can really engage young people and their families in critical conversations about preventing substance use disorders and overdose. I'm really so honored to have Sheriff Robert Luna here today with us to speak on the Sheriff's Office efforts to address the overdose crisis. And I do want to extend my prayers to all of his colleagues and the family of Deputy Ryan Clinken Broomer. We're so sorry for that passing, and we're here to be of support. We're also honored to have Special Agent in Charge Bill Bodner from the DEA, who's going to speak on their efforts to reduce access to counterfeit pills containing illicit fentanyl, and to help us also really be able to increase the use of naloxone. One of the most courageous people joining us today is Alma Sanchez, and muchas gracias. Thank you so much. She will share her own family's experience that drives her to be a leader here about the overdose crisis that we're facing. Dennis Shuk is here. She is the CEO of Behavioral Health Services, who's going to speak on the impacts of fentanyl crisis on treatment do their work on the ground. Dr. Tsai is here from the Department of Public Health's Bureau of Substance Abuse Prevention and Control. He is the deputy director, to share multi-pronged strategies that are being employed to bend the curve related to overdose deaths. And then Jose Escobar will close us. He is our regional health officer from the San Gabriel Valley, and he will provide just some very summary remarks in Spanish on overdose prevention. I do want to start today by asking for a moment of silence as we send our deepest condolences to all the families who lost a loved one due to opioid overdoses. We wish everyone peace and healing. This tragedy has called attention to what has unfortunately become the worst overdose crisis in the history of LA County, as well as the nation, with 7 to 8 people dying every single day in LA County of an overdose. And approximately half of these overdoses are caused by fentanyl. Fentanyl is the #1 cause of accidental death for 18 to 45-year-olds. And the primary cause of 92% of teen overdose deaths in LA County. There's no way to see, smell, or taste if a pill or powder has been laced with fentanyl. Regardless of whether someone experiments with drugs, uses occasionally, or has a substance use disorder and regularly uses drugs, the risk of overdose due to fentanyl or fentanyl-laced drugs can be, as we all know, deadly. And because so many are unaware that the drugs they're ingesting are laced with fentanyl, many overdoses should actually be considered poisonings. In 2021, fentanyl was identified as one of the most common drug types listed as a cause of death in accidental drug overdose deaths, and it accounted for 55% of drug-related overdose deaths in LA County. Tragically, fentanyl overdoses are a significant and growing problem across all of the county's socio-demographic groups and geographic areas. The clear increases of overdose deaths amongst youth and the widening inequities between under-resourced and more affluent groups greatly supports the need to target prevention efforts to those at highest risk to decrease fentanyl overdoses and advance health equity in our county. Awareness of the risk of fentanyl and counterfeit pills, stimulants, and other substances is critical for the public, including youth, parents, and other adults. The Department of Public Health, along with many of the collaborating partners in the county and that you see here today, are deploying a spectrum of strategies to combat the overdose crisis. This includes launching various overdose awareness campaigns, working, as you'll hear from Dr. Eduardo, with school districts to make sure that they have intranasal naloxone on campuses, working with our other LA County departments, the LA County Library, Probation, Families and Children's Services, to stand up educational and naloxone programs, and just as importantly, engaging with our young people through peer leadership programs, such as our Youth Ambassador Program, to build skills on managing emotions and relationships, and to train our young people on overdose prevention and how to use naloxone. All of our work depends on close collaborations, and we're grateful that the speakers here today will touch upon the multi-pronged efforts we're partnering with across the county. With that, it's my great honor to call our first speaker today, Yolanda Vera, who's representing Supervisor Holly Mitchell. Thank you for being here.
Good morning. My name is Yolanda Vera, and I'm the Senior Deputy for Health for Supervisor Holly Mitchell. She apologizes she can't be here today. She is part of her responsibilities of being on the Board of Supervisors. She's on the Executive Committee of LA Metro, and she had a conflicting meeting. I'm honored to share the podium with these speakers to highlight the importance of addressing this opioid epidemic. And as Dr. Ferrer mentioned, we're facing a crisis. Your materials have information about the extent of the crisis. And so what Supervisor Mitchell is trying to have us do is primarily focus on three things. One is preventing deaths. Two is trying to provide more culturally appropriate options for treatment. And third is to go upstream to try to prevent people, especially our youth, from becoming addicted in the first place. And I want to spend most of my time on that last one. But on preventing the deaths caused by fentanyl, Supervisor Mitchell, in partnership with the Board of Supervisors, has worked to ensure LA Metro, sheriffs and first responders have access to Narcan to save lives when seconds count. And our office had its own experience. We received training on Narcan and happened to see somebody who collapsed just outside the office, and we saw in person the amazing impact that it can have. In regard to expanding recovery options, no need for me to say too much. You are here at this amazing center that has a 24-hour recovery hub for people to sober, and then it has a variety of outpatient and residential programs as well too, and I know you'll hear more about that. It's critical that we provide options for our residents, but also looking at their family members, their parents, their siblings, their kids, who are all struggling with how do we deal with this scourge affecting our communities, but do so in a way that doesn't shame our clients, because recovery is difficult and often includes relapses. And so we need to let them know that we're here to give them the full spectrum when they are ready and when they choose to fight this. Finally, I want to give some comments on the need to go upstream. There is a need to do more preventive programs in schools, in communities that are focused on the well-being of our residents, especially our youth and our young people, to give them coping skills so they don't go into using drugs. And this includes a wide variety of things, everything from looking at job opportunities, providing green space, to giving coaching and mental health services. But some of the examples of the things that Supervisor Mitchell has been doing are things like mentoring programs. She created and is expanding a mentoring program, in that case particularly focused on young girls, working with them starting at age 4 and matching them with a trained mentor who can essentially be a friend to them until they reach, they're 18 years old and reach adulthood. And hopefully they'll get that guidance, that voice that can gear them when they're feeling the stress of growing up. Another thing that we're going to be working on is right across the street, I don't know if you've seen it, there is a new Avant Child and Family Wellbeing Center. It's principally on acute kids who may have mental health issues, may be involved in the foster care system. But we also want to build next door to it, and we're doing this in partnership with the Department of Mental Health, a teen drop-in center where teens from the area, they don't need to be chronically mentally ill. They just need a place to drop in, to talk to someone, to get help with their homework, get linked to a job, and if they need services, get linked to substance abuse or mental health services. I know you'll be hearing more from other speakers about this, but this is an example of Supervisor Mitchell's commitment to prevention. And on Overdose Awareness Day, we have an opportunity to shine a brighter light on the destructive impact that fentanyl is having on our communities. I know if we probably call for a raise of hands, many of us will say that we know members who've been impacted. And it's hard and heartbreaking work, and you know it's hard and heartbreaking, but we're not backing down. And we know we can't do this with all of you in the room. So on behalf of Supervisor Mitchell, I'd like to thank the Department of Public Health, Dr. Ferrer, and all the county departments and agencies working on this issue. So I will turn it over now to Dr. Deborah Duardo, who is from the LA County Office of Education, and she will speak about LACO's efforts around overdose prevention. Thank you.
Thank you. Good morning. So honored to be here and great appreciation for Dr. Ferrer and all the partners that are working to address this very, very serious issue. You know, for us in education, for those of you who are not aware, there are 80 school districts in LA County serving over 1.5 million children. And what we're focusing on in education, where students spend so much of their time, is really making sure that our students have the resources and access to the supports that they need to be safe, to thrive, to get an education, and to do well. We really need to scale making sure that children where they can connect, whether that means connecting with a peer at their schools. So we have many peer-to-peer support services where youth are trained to support their peers, issues, whether it's a mental health issue, a drug issue, or some other challenge. The community on dangers of fentanyl, how prevalent it is. That means working with parents and educating parents on how serious an issue this is, and answering questions that parents have and helping them to identify if their children may be struggling or may potentially be using substances. But a lot of work is also targeted to students themselves in making sure that students are aware the substance that's out on the street, fentanyl, that is as dangerous as it is, and making sure that they're aware of resources and supports to help them. It's also working with partners. So many of our districts are using a community school model of making schools the hub of community services and bringing all types of support services to schools, whether it's a mental health issue, a housing issue, a relationship issue, being able to get those supports and finding places, safe places where they can come to school and talk to either a peer, a teacher, or a trained therapist or counselors at their school. Another thing that we've been able to do is, because of the shortage in counselors, is getting telehealth services through a partnership that we have with Hazel Health. So right now, every student in LA County has access to telehealth, mental health services remotely. These are all critical things that we need to do, but another thing that districts understand is really having assessments in place and systems where they can identify that may be struggling, whether it's we see suddenly behavioral issues taking place, students being disengaged, and really being able to identify which students we need to make sure a counselor or a teacher or a peer is working, has a plan in place to connect with them and to make sure that they're doing well. There's a lot of work to do. We know that schools are a place where children and parents feel safe coming to school, asking for assistance, and so we're opening up our doors, making sure that resources are available, that teachers are trained, that parents are educated, that understand what their resources are, so that we can children, youth from turning to substances and instead asking for help when they need it. Honored again to be here, and I would like to introduce Sheriff Robert Luna, who will be speaking next. Thank you.
Thank you, Doctor. And I do want to acknowledge as well that all of us sitting up here, even though we work different disciplines, and I'm very impressed with what we're doing, knowing, understanding there's a lot of work to do, that we're doing this work in the memory of everybody who has been poisoned. Thank our public health partners for bringing attention to such a critical issue plaguing our communities, quantities. In 2022, our Narcotics Bureau seized 2 billion fentanyl pills. And already this year, we have seized 2.4 million pills. We're way ahead. We're way ahead. That's not acceptable. We have seen not only an increase in the drug seizures, but the number of deaths, unfortunately, that our communities are suffering from. In 2023, we had approximately 236 drug-caused deaths in our jurisdiction. And year to date, and I'm sorry, that's 2022, that we had 236 drug-related deaths. Year to date in 2023, unfortunately, we've had 205. That is not good. So sadly, we anticipate that these numbers will increase. I want to talk a little bit about the enforcement end, and as I'm up here talking about enforcement, I get it. It's much more than enforcement. There's so much work that needs to be done on the prevention end, just so much work, education. So when we talk about these numbers are members in our community and loved ones. We want to bring justice to the families that are being poisoned by these drugs. So when we look at it, it's the families that we're dealing with, and we just take a very different approach. So not too long ago, we did start the Sheriff's Overdose Response Task Force, where we have death investigations. Youngest victim being 14 years of age. We also have sheriff investigators assigned to the High Intensity Drug Task Force, HIDTA, that are working along drug investigators with the federal and local partners to combat the flow of opioids and other drugs that come into our community. Just some of the most recent trends, most of these drug-caused deaths cases involve some sort of social media platform. So we always advise, especially with our kids, parents, pay attention, challenge your children to who and what they're doing on social media. As a father, it's not easy. You ask, it's like they get really mad, but it could be, through town hall meetings, public events such as the DEA prescription take-back program. Patrol stations conduct Narcan demonstrations. Public and school resource deputies discuss the importance of drug prevention to students and faculty at the different schools we have the pleasure of having contracts with. The opioid crisis is plaguing every community across our nation, but every neighbor, parent, friend, and coach across our nation, can make an absolute difference by talking about this, educating themselves and others about the dangers of opioids and spreading that awareness. It is education. It is about awareness. And I really want to thank each of you for taking the time to be here today. And now I have the absolute pleasure of introducing not just a friend, but a true partner in these efforts or anything dealing with narcotics, and that's Bill Bodner, the guy in charge of the LADEA office. Thank you, Bill, for your partnership.
Thank you, Sheriff Luna. I'd like to speak very briefly about where we are seeing harm in our community and the specific steps we are taking with the community partners here to address that harm at each point. I'll then close just giving a brief overview of what our current fentanyl interdiction is. The first area we're seeing harm from fentanyl in our community is the obvious one. It's not new to us. It's that portion of our population with opiate use disorder. The challenge is to do a better job of getting those who are suffering into treatment. DEA has regulatory authority for many of the drugs used in medical assisted opiate use is a huge harm causation with this group of drug users, and this is where we are losing our teenagers. We need to continue working hand in hand with school building awareness about fentanyl and fake pills, how our children to make safer, healthier choices. 2 days ago, DEA held a summit in Las Vegas, where we presented a 3-hour block of education to 740 children from Cook County School District. We have done similar programs in Los Angeles, and we look forward to continuing them here in our community. Providing education and building awareness is something each one of us can do today to save a life tonight. Here's the reality. Teenage drug experimentation is not new. The consequences, however, have never been more devastating. The final area where we are seeing harm as partiers and may use cocaine once or twice a month. Because fentanyl is often mixed with cocaine and, believe it or not, sometimes mistaken for cocaine, the risk of death from cocaine use has never been greater. When you see an overdose cluster where multiple people die at one location, it is often due to one of these two scenarios involving cocaine. We have been working to build awareness around this specific issue, and I feel like in this area we have made some headway. It appears the use of and demand for cocaine was down in the Los Angeles area over the summer, and I hope as a result of that we see fewer of these overdose clusters. If you are someone who falls into this group, but you are not willing to stop using cocaine recreationally, test your drugs, and know that although that may help mitigate your risk, it is still extremely dangerous behavior, and abstinence is always the safest choice. Our enforcement strategy focuses our resources where the most harm is being caused. The first area is the wholesalers, those bringing hundreds of thousands or millions of fake pills containing fentanyl into our community, those bringing 20 kilograms, 40, 60 kilograms of fentanyl powder into our community. We know by looking at CDC data that when we reduce the supply of a drug, we also reduce the harm caused by that drug. When we work at this wholesale level, we are reducing the supply, holding the large-scale dealers accountable, and making our community safer. The second area is the targeting of drug dealers who have sold drugs that killed. The sheriff spoke of this. Whenever there's a drug-caused death, our goal is to trace the drugs back to the dealer and charge that person with a significant federal drug distribution resulting in death charge. Now, why are these cases important? In September 2020, we had a situation in Pasadena where one drug dealer in one weekend caused 7 overdoses and 3 deaths. In September of 21, there was a situation in Venice, California, where one drug dealer caused 4 overdoses and 3 deaths in one night. And then there was the case in May of 22 of one drug dealer in one afternoon causing 3 overdoses of teenage girls in Santa Monica. Tragic. They survived, but still tragic. As a community, we have to have realistic expectations about what happens the next weekend if law enforcement doesn't intervene and file a criminal case on that person. It's been my experience, and I'm sure Sheriff Luna's experience, that this cycle of drug distribution and resulting harm continues absent law enforcement interdiction. So with that, I'd like to introduce Alma Sanchez. Alma is someone who works with VOID, Victims of Illicit Drugs. There's someone who DEA has partnered with now for a couple of years to try to build awareness, especially with children. Thank you, Alma. Take it away.
Thank you. Gotta lower it down. Good morning. My name is Alma Sanchez. I am Denilson's mom, forever 19th. I stand with and in front of you today in representation of all the mothers whose hearts have been shattered and the ones who are struggling to find the strength to live each day without their children by their side. I am here as a representative of VOID, Victims of Illicit Drugs, and an advocate for awareness, change, and education, hoping to spare others from the excruciating pain and heartache that comes from losing a child or a loved one. Accessing the substance is far too easy nowadays. Parents, everything you try to protect and shield your children from, it's only one click away. It's right in their backyards. They only need a phone, a computer, and a Wi-Fi, just like my son did. Denilson was one of a kind. He was a firecracker, full of life. He was always very compassionate towards others. He was athletic. He really loved sports. A kid with a lot of potential, goals, and dreams. His ultimate goal was become a drug counselor and a preacher to help out troubled youths because he knew what it felt like. Denilson struggled with ADHD growing up. In 2019, he was involved in drugs for the first time, even when he was only experimenting. Suddenly, the COVID-19 pandemic happened. The lockdown, isolation, and online learning made it worse. He had so much time on his hands. Doing nothing was, in fact, doing something. He had easy access to social media and the drugs were being delivered right to my doorstep. It was easy as ordering a pizza. His drug of choice was dab pen or wax pen. As his mom, I knew what the outcome was. I would always try to be there and be open when it came to addressing the drug conversation. During that period of time, he ended up in the hospital due to him being in distress. When he was released from the hospital, they ended up prescribing Adderall, just to eventually have to rely on it and just to feel okay. Eventually, in February of 2021, he decided to seek help in a rehab facility for the first time. Due to the fact of missing his family, he struggled to stay in one. On November 25 of the same year, I received my last phone call ever. He emphasized that he was willing to complete his program in hopes to be okay and coming back home. He even said he was clean and working into getting his life back on track. Little did I know it was that 2 days after, on November 27, he would check himself out from the rehab facility with the full intention of making it home for the holidays. He made his way to the train station, destination where I live. While waiting on the train station, he came across with a random person. This person provided him with a counterfeit pill laced with illicit fentanyl. Around 8:25 p.m. of the same day, he was found unresponsive near the train platform by a bypasser who made the call to the EMTs. When the EMTs arrived, they proceeded to do CPR. They attempted everything possible, from EpiPens to Narcan. He unfortunately fell into cardiac arrest. Once getting to the hospital, he was dead on arrival. They were able to revive him and get his heart going, being put on life support. For 5 days, he fought for his life. And finally, on December 1st of 2021, after running all the pertaining tests, he had double certification brain dead. In other words, officially dead, leading the hospital to make the decision to remove him from life support without any next of kin by his bedside. The problem was that by the time he was found unresponsive, he had no ID nor a cell phone with him, making this hard to identify him. Fast forward 9 days after, on December 9, as I was having lunch and opened my social media account per usual, and the very first thing that showed on my news feed, it was an article about a young teen trying to be identified. I learned about his passing through the news. Even though I was still thinking my son was in a safe place getting the help he needed, later, after doing my search and calling the rehab, only for them to tell me that he had left the premises on November 27th. I got the call that no mother ever wants to get. It was a call from coroner's office. I can still hear the voice of the other person who told me this tragic news. I'm sorry, ma'am. We have your child here. He didn't make it, and you need to come and identify his body. Up to this day, I will not know what this person sold my son. What I do know is that it was a counterfeit pill with a lethal dose of fentanyl. So for anyone that is ready for this conversation, it is vital and crucial and important to stay informed about the rising cases of fentanyl and overdoses amongst young people. Let's help them start the conversation to help them create a better future and make better decisions. Let's end stigma. There's still so many uniformed families that don't talk about or address the issue because of the same shame that comes from surrounding drugs and substance use disorder. We need to come together. Fentanyl, it's everyone's problem. We need our legislation, our law enforcement, and all of our communities to come together as one voice. Fentanyl has changed the game, and kids need to be aware how dangerous this drug is. Fentanyl does not discriminate. It doesn't matter your age, gender, culture, or how well you've been raised. The times of experimenting are over. There are no more second chances. Kids are paying the ultimate price with only one try, and their lives being taken away from them, just like my son did. Kids need to learn from their mistakes, not die from them. Education is power and knowledge, and education is not condoning, but giving the youth the power to make life-saving choices. Because one line, one time, one pill can kill. Thank you very much.
Thank you, Alma. Next up, we have Denise Shook from Behavioral Health Services.
Thank you. Good morning, everyone. This is really an important conversation, and I'm really honored to be a part of it. So Behavioral Health Services, we are actually celebrating our 50th year of providing treatment services here in Los Angeles County. What we have today, we are part of the Behavioral Health Campus with our Sobering Center, our Respite, which is a sobering center, and our 3.2 withdrawal management program. I want to thank all the speakers for talking about not only the detriments of fentanyl, but just giving us the education on the dangers of it and what it's doing to our communities. How it's affecting our programs the most, our treatment centers the most, is that as they talked about, when individuals come into treatment and identify what their drug of choice is, they often don't know that fentanyl is a part of what they think that they're using. And so it becomes challenging for us to identify the correct course of treatment if we don't know what they're using, because they don't know. And so part of our everyday thing is to, at intake, test to see if there's fentanyl in there so that we can have the appropriate course of treatment. The Sobering Center is somewhat new to Los Angeles County. We have the second one here in the county, and that gives the opportunity for a person to come in and sober up for 2 minutes to 23 hours and 59 minutes. It's important because we want to be able to reach what Dr. Sai always talks about is the 95%, and we think those folks that come into our Sobering Center is part of the 95% of individuals who we're unable to reach for various reasons. They might not be ready, but it also gives them the opportunity to possibly be educated on the opportunities for treatment services in our community. And we have it all right here on the campus. From withdrawal management, from the Sobering Center, they can be offered withdrawal management or any level of care of treatment here on the campus. So, kind of lost for words after Elman. So sorry for your loss here. So we're here to provide the services here in the community. That's, we have about 15 sites, and besides withdrawal management site that we have here. We have some additional ones throughout the county. And I don't have my paper here to talk, but anyway, I'm so sorry. So anyway, treatment is available, just everybody don't know it. But besides treatment, I'm sorry, I want to talk about, we also have prevention services. And our prevention services not only talk about educate the youth, it also educates communities and parents. And we often work with the DEA and the Sheriff's Department providing outreach events throughout the communities. So there's treatment services out there. It's just about getting the information out there, what services are here, how to access them, and make sure that they can access them easily, and just be there for the community. And that's who we are. So thank you. So now I want to introduce Gary Sy to talk about the fentanyl campaign.
Good morning, everyone. Tragically, overdose deaths continue to rise, even though there are less individuals across all age groups that are misusing opioids. Illicit fentanyl is the primary reason why, because of its potency, because of what we've all talked about in terms of it increasingly being found in counterfeit pills, as well as being laced in illicit drugs, such as methamphetamine, heroin, and cocaine. As a physician, I've been on the front line and seen the impact that fentanyl, xylazine, and other deadly combinations have caused on our communities. I've heard the stories, like Alma's, of mothers, brothers, friends who have lost someone close to them. I've witnessed the struggles of individuals who are desperately wanting to stop using drugs, and also seen the joy and exhilaration of recovery. On National Opioid Awareness Day, it's important that we celebrate those in recovery, have compassion for those who are amid their addiction and need our love and help, and also mourn those that we've lost. With this in mind, the Department of Public Health also wants to use this opportunity to announce its most recent media campaign called the Fentanyl Frontline. This campaign highlights key information to reduce the risk of overdose deaths, highlight resources for those seeking help, and to increase the awareness of the risks of overdose from fentanyl and counterfeit pills. Through billboards, social media, videos, television, and radio, the campaign shares practical ways that anyone can save a life using naloxone, as well as highlighting accessible resources if a loved one has a problem with substances and is interested in services. Importantly, in March of this past year, the FDA approved naloxone for over-the-counter use, and so it will soon be accessible more broadly across our communities. Naloxone is one of the most effective tools that we have to reverse opioid overdoses. It's not addictive, doesn't cause the same effects as opioids, does not increase the risk of substance use, and most importantly, it's life-saving. In addition to significantly expanding the availability of naloxone across the county, public health has also implemented other strategies to address both the upstream as well as downstream impacts of fentanyl and other drugs throughout the county. We've applied novel approaches to reach people through substance use prevention and lowered barriers to care by expanding access to harm reduction, treatment, and recovery services, including the expansion of substance use prevention investments by over 260% and increasing residential substance use treatment beds by over 200% over the last several years. We also recognize that many people are not yet interested or able to stop using substances and are cultivating a system that's designed not just for the 5% of people seeking care, but the 95% of people with substance use disorders who need treatment but aren't yet interested. So today, on National Opioid Awareness Day, we want to share a few messages of hope and action. One is to get naloxone. Everyone should have naloxone in their car, in their homes. It might save the life of someone you know and love. It's available right now with a prescription through a prescriber. It's available without a prescription through pharmacies. It also will be available soon over the counter. Two, only use pills and medications that have been prescribed to you and obtained through a local pharmacy. That's a really important point in order to avoid counterfeit pills. 3, if you do use substances, please don't use alone. Having someone with you to monitor in the event of an overdose, to call 911, to administer naloxone can be life-saving. 4, visit fentanylfrontline.org. That's the website for our fentanyl media campaign for resources and more information. And lastly, if you think that if you or someone you know might benefit from treatment, please do contact our Substance Abuse Service Helpline, also known as the SASH, available 24 hours a day, 7 days a week at 844-804-7500. And so with that, thank everyone for being here. I'd also like to introduce Jose Escobar, our Regional Health Officer for San Gabriel Valley, to share a message.
Buenos días a todos. Estamos de luto con familias como la señora Sánchez hoy, que perdió un ser querido a la sobredosis de opioides. Su historia y las miles de historias como la de ella son tragedias incalculables. El fentanilo es la causa número 1 de muerte accidental entre las personas de 18 a 45 años y la causa principal del 92% de las muertes por sobredosis de adolescentes en el condado de Los Ángeles. El fentanilo se mezcla con casi todos los tipos de drogas ilícitas, como la metanfetamina y la cocaína, y también con pastillas falsificadas como la oxicodona y la Percocet. En el 2021, los latinos estuvieron entre la mayor proporción de muertes por la sobredosis de fentanilo en el condado de Los Ángeles y representaron el 35% de las hospitalizaciones por sobredosis del fentanilo. Hoy, en el Día Nacional de Concientización sobre los Opioides, el Departamento de Salud Pública, junto con la Oficina de Educación del Condado de Los Ángeles, el Departamento del Sheriff, la Agencia Antidrogas y los padres de seres queridos que han muerto por una sobredosis de opioides, queremos que sepa que mientras estamos en la peor crisis de sobredosis de la historia, hay esperanza y hay ayuda. Todos podemos educarnos sobre los riesgos del fentanilo ilícito para nosotros y para nuestros seres queridos. Todos podemos aprender a reconocer los signos y síntomas de alguien que sufre una sobredosis. Y todos podemos tener la capacidad de responder con naloxona que salva vidas. Esta es la razón por la que el Departamento de Salud Pública también quiere aprovechar esta oportunidad para anunciar su campaña mediática más reciente que se llama The Fentanyl Frontline. La naloxona revierte una sobredosis de fentanilo. La naloxona es fácil de administrar, no es adictiva y no causará daño si se administra a alguien que no haya experimentado una sobredosis. Lo más importante de la naloxona es que salva vidas. Puede salvar vida de un ser querido, de un amigo o de un vecino. Además de ampliar la disponibilidad de la naloxona, el Departamento de Salud Pública proporciona un espectro completo de servicios de prevención, tratamiento y recuperación. Para acceder a cualquier de estos servicios, puede visitar fentanylfrontline.org. Mi última súplica para todos es que consigan naloxona. Podría salvarle la vida a usted o a un ser querido. Gracias por su tiempo. Ahora la doctora Ferrer brindará las palabras de cierre.
Muchas gracias, Jose. Thank you, everyone. We're going to open for some questions, and then we'll just try to close quickly, but happy to take questions from the press. Sure.
The availability of naloxone is one thing, but are we talking about something where eventually we might see it as part of the first aid kit that any family would pick up and put into their car, into their home, something like that? I mean, people get hesitant about going and buying a drug over the counter.
Yeah.
But if it's packaged in there, it's in the box, there's often that, okay, it's just part of what I need to deal with.
Yeah, it's a great question and actually a great observation. And yes, we'd like to see this be in what people consider a first aid kit. We do think, given the devastating numbers that we just shared with everybody and the devastating stories, Naloxone works, prevents an overdose from resulting in a death, and does not harm people who haven't used an opioid. I mean, I think some people are very hesitant to use it because they're like, I have no idea what this person seems unconscious, they're not breathing, but I don't really know what they took. I don't want to hurt them. The good thing about naloxone is it is a life-saving drug that doesn't really have any harmful effects, and it should be something that every family has. And I love your suggestion that we should think about it as the first aid kit. I carry a dose of naloxone in my car, and I have naloxone in my home. And I think that that's a good message for everyone. I also want to note that we do distribute free naloxone, particularly for us. We're trying to make sure we reach out to people who are using drugs so that they know this is imperative for them to carry for themselves or for the people they're with. But again, I don't want the cost of naloxone to be the obstacle that prevents people from making sure they have this life-saving drug.
What's the current rate for a dose?
$50, Gary?
Yeah, around there.
$50.
$50, what does it need to get knocked down here to make it reasonable?
Yeah, I mean, the lower the price in general, the more accessible it is. I mean, I think right now for over-the-counter dose that's been announced is around $44 or so. There's going to be another product that comes out from a nonprofit. They haven't announced the price yet. We'll see what it is. I mean, I think we would like to see it as low as possible. Just we do view naloxone as something that needs to be as widespread as EpiPens. Right? A lot of individuals carry EpiPens. There is not stigma attached to EpiPens. So I think thinking about it, whether it's through a first aid kit or as other things that are readily available, I think is really important.
Is there a concern, though, with the naloxone distribution for those people who are currently using opioids? That it's sort of like a false insurance policy. The idea, hey, I can use, I've got it, or somebody's got it, not a problem. When, sorry, I'm sorry, anytime you're taking a drug that didn't come from CVS or Walgreens, and you don't know the pharmacist, it's the same as putting an automatic pistol to your head, dropping the safety and pulling the trigger.
Yeah, I mean, it's such a good point about is there going to be an unintended consequence? I want to say, like, one thing about naloxone is you're instantly not high. So if your whole purpose of taking a drug is to make yourself feel a certain way when you use when you're given naloxone, you will instantly not be high. We don't really have any issues right now with people abusing naloxone. As a matter of fact, we'd like more people to carry it and more people to be using it. We think we have the opposite problem of people not carrying it and not using it when they ought to be using it. So again, our big thing here is, we want to make sure people know recovery is possible, come in and get help. But if you're not ready for help, we want you to stay alive. We love you, your families love you, people need a second chance or a third chance or a fourth chance. Naloxone is one drug that can help us with opioid overdoses. I just want to check that, just make sure nobody else has a question, and for any of the other speakers as well. Do you want? Yeah.
So scientists tell the DEA it could be as little as 2 milligrams. And it's going to depend on a lot of things. Do you have a history of opiate use? How big a person you are? How you're taking it? Many of these things play into it, but 2 milligrams is a baseline number.
Well, are we seeing any instances where unintended fentanyl poisonings are happening?
Yeah, absolutely.
Do you want to expand on that a little?
Well, a lot of times, I see it with teenagers all the time, when they are perhaps going through some kind of anxiety, social anxiety, teenage issues, they seek out what they think is a legitimate Xanax drugs because a parent took it, because a friend took it, and it helped them, and they end up getting something that looks exactly like Xanax. It has no benzodiazepine in it, and it's actually fentanyl. That is an unintentional fentanyl poisoning.
How aggressive do we have to get into getting it in kids' heads so that it doesn't come from Walgreens or CVS they're committing suicide.
Yeah, I mean, we have to get that in kids' heads, but drug experimentation is not new. We will not stop drug experimentation. We just have to give children information and empower them and encourage them to make safer, healthier choices. That's the bottom line.
Thank you. Yep.
What's the average shelf life for the nasal spray, doctor?
Yeah,
3 years. On the microphone.
Yep. 3 years. There have been studies, though, demonstrating that a lot of the medications we use, including naloxone, are effective well beyond that. But officially, it's 3 years.
Great. So thank you. I want to just, again, I want to, thank everybody. I want to really acknowledge and thank our media partners as well. We appreciate all of your ability to make sure your viewers and your listeners and your readers have really good, accurate information. We never can know everyone who will be impacted by an opioid overdose, but it's important to recognize that with fentanyl, we're all at risk. And as a community, we can be educated on the risks of illicit fentanyl, learn to recognize an overdose, and be empowered to respond with life-saving naloxone for those on the fentanyl front line. And for that reason, we are going to have a demonstration for those of you who want to learn how easily it is to administer fentanyl. We're going to go ahead and do a demonstration for you. But I know that our panelists all have to leave, so I want to let the folks that need to go, and again, thank everyone who's here with us today. You guys can introduce yourself.
Totally. Hey everyone, it's nice to meet you. My name is Dr. Sid Puri. I'm part of the team, the harm reduction team at SAPSI, and I'm joined today by Gray Bonar, who is currently an EMT, but a graduate of Sun Valley Poly High School and currently a sophomore at Pierce College. So we're going to go over briefly the signs and symptoms of an opioid overdose, and then Gray's going to demonstrate, he's currently also an EMT, how easy it is to use naloxone on me. Okay, so signs and symptoms of an opioid overdose. Can anyone name one for me? Blue lips, perfect. Okay, how about another one?
Gurgling.
Yes, a death rattle, a snoring noise from your throat. Perfect. What else? Not responsive. Perfect. These are all great. So this is the person who's not breathing, they're not responsive. Maybe you try to feel their heart rate and it's very low or slowed. They're blue lips, their skin is cold and clammy. Those are all the main signs and symptoms. If you open their eyes, their pupils are going to be very, very small. So when all of that happens, when you see someone like that, please use naloxone to save their lives. Gray, why don't you show us how easy it is?
All right, so all you gotta do is peel, place, and press. So if Dr. Puri here had overdosed on fentanyl, I would be saving his life right now. So all I would have to do, let's say he's passed out on the floor, put it up here, and because it's that harmless, I'm gonna inject it into Dr. Puri's nose right now. That's it. He's good. Now, you have to wait 1.5 minutes to start a timer. If they don't respond within 1.5 minutes, hit them again. And you need to make sure that you get that person help from 30 minutes to 90 minutes. That's your window, because naloxone only works for 30 to 90 minutes. They can stop breathing if they don't get help within those 30 to 90 minutes. You got to make sure you get them to an ER.
Thanks, everyone.
Doctor, how many sprays are in each one?
So each box has 2 sprays of naloxone in there. So you will have another one to use in the other nostril if they don't respond to the first one. Thanks.
Thank you, everyone.